All right, so I would look at the question, determine what the question's asking me, and name 6 things. So what are 6 things in your mind that you could name about a postpartum client? I mean, like just the first basic things that you could think about. This person's losing blood, so what do we expect is going to happen with them?
Increased heart rate.
Before all that happens, they're going to start, I mean, yeah, increased heart rate, yes. But just basically, they're going to go into shock if we don't stop this, right?
Hemorrhage.
Okay. So how much blood would be considered a hemorrhage?
Above 1,000 ml.
Okay, a total volume of 1,000 or more, regardless of the route of delivery, right?
Yeah.
Okay, what would that blood look like?
Bright red.
Okay, is it always going to look like it's gushing out of her?
No.
No.
Sometimes it could look like a trickle or something like that, right?
Mm-hmm.
What are things that we have to look at to see, like physically? If I'm looking at my client, what am I looking for to see if she's hemorrhaging?
Uterus, attorney.
I'm sorry?
Boggy uterus.
Okay, she might have a boggy uterus, but if I just physically look at her bottom, what areas would I check to see if she's bleeding?
Under her.
The
Okay, I
vaginal
gotta look
area.
under her for that pooling blood. We got to look at those pads. How many is she going through, right?
Mm-hmm.
Okay, what are some of those causes of that hemorrhage?
Bladder distension.
Blood distension, laceration.
Okay, bladder distension, why? What's happening?
It kind of misplaces the uterus and prevent it from contracting.
Okay, is that something I would see right away, or is that something I would see after the client goes home and comes back?
You can see that right away.
Okay, what other kind of things would cause a postpartum hemorrhage that I might not see right away?
Manual removal of the placenta.
Okay, I was thinking more about the placenta retaining fragments, right?
Yeah.
Right.
That as
Because
well.
that's something that we might not see with the client right away. It might happen later down the road.
Right.
Okay, why would we manually remove the placenta?
Because it didn't fully come out. Well, that's what I was leading to, the
Okay,
pieces
good.
being
Go
left.
ahead, keep talking.
So some of the placenta was still retained. So then you would have to manually remove it because it's not coming out with the massaging of the fundus and trying to get it pulled out completely.
Okay, so that's sort of an intervention we do to prevent postpartum hemorrhage. When we look at the placenta after it's come out, we inspect it to make sure it's fully there, right? And if it's not, then we may have to go in and manually make sure that some of those other things are removed. Okay, all right, good. This is how you want to generate that brain every time you do a question, because if you don't do this, then one, you're not keeping the information fresh, and you're not making it easier on yourself to answer the question. So let's look at some of the answer choices now. I don't even look at the answer choices when I do that, by the way, because I want to see what do I know without looking at that. Because if I don't know everything I need to know about this, then I need to go back and take another look at it. Because when I get a question like this, select all that apply, the more information I can bring to my brain, the easier it'll make for me to answer this question correctly. Because with select all that apply, it's strictly true or false. So if my client had a postpartum hemorrhage, I would give uterotonic medications as prescribed to increase uterine tone. True or false?
True.
True. And I got to be careful what I give, but my first line drug here is usually what?
The oxytocin.
Oxytocin. And how am I going to usually give this? Can I give it IV push?
No, IV rate. Probably piggy bag.
we got to give it over a slow period of time and monitor the client really closely, right? What about 4? Would I want to give mom oxygen through a non-rebreather mask if she was having a postpartum hemorrhage?
Yes.
Probably she's in respiratory distress.
Okay, yes, we would want to do this because, like you said, that heart rate's going to go up, right? Because the body's going to try to pump out more blood here. Classic sign, actually, of hemorrhage for a postpartum woman is that increase in heart rate. Why? What is her normal heart rate postpartum?
She's bradycardic.
Bradycardic. Good. All right. So we would want to do this. What about putting in that indwelling urinary catheter to monitor that kidney perfusion?
Yes.
How about blood products?
Yeah,
Yes,
when she's
depending on the amount of
hemorrhaging.
blood loss.
Right. It would depend, but we would prepare for it, right? Because if she loses too much blood, we got to protect her. And what about assessing for uterine apnea?
Yes.
Right, because that is what?
The uterus probably failed to contract.
It's one of the #1 causes of postpartum hemorrhage too, right?
Correct.
Okay, good job. All right, so in this postpartum client, if the bleeding is excessive, signs of shock are evident, then we would contact that primary healthcare provider. It's a life-threatening situation. We would never leave that client, okay? So if the question says go outside the room for 15 minutes and come back, yeah, go ahead while your client dies. Go ahead, that's smoke. All right, and then determine the cause of the hemorrhage because the cause is going to guide treatment, right? So if it's apnea, then we may have to give that oxytonic, but the first thing we would want to do is check that bladder, make sure it's not distended, right? We might have to give a catheter to empty that bladder because what kind of things could cause that bladder to become distended?
Urinary retention.
Okay, but why? Why would mom have urinary retention?
During pregnancy or after
Well, we're talking postpartum here.
Sometimes they don't feel the urge to go to the bathroom right away.
Okay, why? What's
It's
some of the
because
things that interferes with that?
Maybe the
Because they are-
anesthesia.
Good, anesthesia. Okay, so you have to go to that level of thinking. All right, you have to be thinking all the way around. How's this client going to be affected? Because you don't know how the question's going to come at you or what kind of things that they're going to ask you about. So if you know these things, that can guide you to how you're going to treat. And they're asking you just basics here, even though it might not seem like it. All right, nurses caring for a client in labor when a prolapse umbilical cord is noted. In order of priority, which actions should the nurse take? So look at all your actions first, okay? Decide what you would put first and last. This is how you do these questions. And then put your other stuff in there. Allow Maslow's hierarchy to guide you.
So probably will say 2, monitor fetal heart rate and tone.
So that's what you're going to do first, monitor the fetal heart rate and tone.
Yep.
Everybody agree with that?
Yep.
Okay.
Then probably 5.
Everybody agree with 5?
How about
Hopefully
4?
everybody's reading and giving this some thought. What would you do? If you disagree, let's talk about it. Because somebody else may disagree too, and you may be right or wrong, but talking about it is going to help you here.
How about 4?
Okay, you think 4 should be second?
Yeah.
Anybody else?
I think you should elevate the fetal presenting part first.
Okay, why?
Because it's cutting off the circulation of the baby by being on the cord.
Okay, so you think that should be the first thing that you do?
Yes.
Okay. And then what?
And then number 5.
Is there another way you can relieve pressure?
Knee to chest.
I think
That'll be 5.
the knee to
Go with
chest
5.
position.
Okay, so you're relieving the pressure first because that's the first thing that's going to provide some sort of relief to the baby at least.
Right.
Okay, and then what?
And then probably 4. And 2, and then 1.
All right, look it over good. You happy with that? Good job. Let me get this thing off of here. Okay, so the reason why 3 and 5 were first was because the first thing you had to do was get that interruption in flow corrected. All right, and then 4 is going to help mom. All right, and the baby. Then you could go to 2 and then get that baby ready for birth. If you want to see the rationale, here it is. Basically everything that we talked about. And of course, you never try to push that cord back in. List in order of priority the actions the nurse should take when a client in labor is experiencing eclampsia.
And then first you have to stay with the client.
Okay. So you're with the client. What's the next thing?
Sit and ensure the airway is open.
Okay, good.
Then you wanna maybe wait to control the seizure.
Maybe 5.
I think 5 is a little presumptuous here. I don't think I would do that yet because that says after the seizure ends.
Think 2 or 3 monitor fetal heart patterns or administer medications to control
Okay,
the
so
seizure,
let's try 3 here.
and then administer medications to control the seizure. Well, 4 would be last, right?
4 would be last.
And then
So 5
Oh.
and 4.
So I went ahead and picked that because you said 4 would be last. So that meant that the next one had to go after that. So
5. Right. Good job.
okay, so in this case, you stay with the client, call for help, make sure the client has an open airway. If she's not already on her side, you're gonna put her on her side. That allows for better circulation to be promoted through that placenta. And it also can help prevent aspiration if mom does have the seizure. All right, because that's really considered that recovery position. That's where we would put someone, even if they weren't pregnant. Also, it would help with placental oxygenation, and again, putting that face mask on. That's going to provide more placental oxygenation. You're going to note the time the seizure began, how long it lasts. You'll monitor the fetal heart rate. You'll give medications as prescribed. A lot of times this is going to be what? What medication? What are we going to give here?
Magnesium.
Say it again.
Magnesium.
Magnesium sulfate, yes. All right, and then after the seizures ended, you would put that oral airway in to maintain the airway, and you'll suction the client's mouth as needed. If needed, then you'll prepare for the baby, and then at the end, you would document everything. The client in preterm labor is being started on IV mag sulfate to stop contractions. Several hours later, when the nurse is performing an assessment, the following data is obtained. Blood pressure 110/66, pulse 66, respirations 10, deep tendon reflexes absent. What should the nurse do next? So what's going on here?
Magnesium toxicity.
Okay, we gave too much magnesium likely here. All right, everybody agree with that? How do you know we gave too much magnesium? Somebody else tell me.
Absent deep tendon reflexes.
Okay. What else?
Also respiration
Also the
rate.
The
respirations.
respirations.
Okay, these are all signs you should know because they might ask you on an exam, what would you expect to see in this client? Now, how would we fix this?
Calcium gluconate. Administer calcium gluconate.
Okay, So you know that the other answer choices, we wouldn't probably expect to see seizures here. All right, because we've decreased the mag level, but we decreased it too much. We would expect to see potential cardiac arrhythmias though, and some of the signs that you would see with hypocalcemia, because if the magnesium rate is too low, I mean, if the I'm sorry, let me rephrase that. Magnesium would be high here. Still, we would look for cardiac arrhythmias. We would also look at any things that we would see with hypercalcemia. They're very similar, the magnesium and the calcium, in how they affect the body. All right, so our magnesium is going to be too high here, not too low. All right, so the other answer choices, hopefully you could have ruled them out if you didn't know the answer to this. The client with preeclampsia is receiving mag sulfate. The nurse should assess the client for which sign of magnesium toxicity.
We just mentioned respiratory rate of 10.
Okay. Why not 4?
Because I think it's in the range, it should be 4 to 7 or 7.5.
Okay, why not 2?
Presence.
It should be absent, not present.
Okay, and why not 1?
That is part of preeclampsia, proteinuria.
Okay. And see, again, if you know these things, you could be your own rationale. Don't wait on the question to be the rationale for you. Use what you know to rule stuff out, get rid of it so you go back to the right answer. Because a lot of times what will happen is you'll see a question like this and you'll see an answer you like because it looks familiar and you pick it. Or you don't know and you just guess. Oh, that magnesium level looks high. And you just guess. You don't want to be guessing. So again, say to yourself, what do I know about mag sulfate? What do I know about administering it? How would it affect the client if I gave too much? Okay, so signs and symptoms: central nervous system depression, including respiratory depression, loss of deep tendon reflexes, sudden drop in the baby's or mom's heart rate and blood pressure, and it's excreted through the kidneys. So if they have a kidney problem, it can make them more susceptible to the toxicity. Levels 4 to 7, good job on knowing the levels. Jersey College may test you on the levels as you start to move along. You know, NCLEX is getting away from testing people on lab values, but for your exams, you might need to know them. Now they're trying to give people reference ranges. So hopefully you might see some of your questions in the future coming down to that. A client experiencing preterm labor at the 29th week of gestation has been admitted to the hospital. The client has a prescription to receive betamethasone, but delivers too quickly for administration. As a result of not receiving the medication, which condition is most likely to develop in the preterm newborn? Now, for you to answer this question, you first have to decide, why do we give the betamethasone? So why would we give this to mom in the 29th week of gestation?
I think it's to increase the surfactant.
Okay, everybody else agree with that?
Yes.
I do.
Okay, it increases the surface area in the lungs for the baby to be able to perfuse oxygen. That's the bottom line, right?
Yes.
But what is it?
A steroid.
It's a steroid. So when you're given this, you have to think about what kind of side effects might we see when we give a steroid. Will we see hypoglycemia?
Yes.
If we give a steroid, I
Oh,
know,
no,
Hyper.
no,
likely
hyper.
hyper, right? Because
Yeah,
it
yeah.
tends to increase, okay? What about the hyperbilirubinemia?
No.
The steroids somehow help a little bit with the red blood cells. And then, of course, steroids aren't going to help with chlamydia. Methylgonorvine is prescribed for a woman with postpartum hemorrhage caused by uterine atony. Before administering the medication, the nurse should check which most important client parameter. What
Blood pressure.
conditions is this contraindicated in?
Hypertension, vascular diseases.
Everybody agree with that?
Yes.
Okay, I hope in your mind you guys are answering these questions and learning this, because I would expect you to be tested on this stuff. Right, so this is an ergo-alkaloid. We use it for postpartum hemorrhage. It's not our first line, because what's our first line?
It was say oxytocin.
But if the woman wasn't responding to oxytocin, or if oxytocin were contraindicated in her for some reason, then we would move along to some other drug.
The Mistopolo or something.
Okay, so
Okay.
this would help to contract the uterus, but it does cause vasoconstriction of the arteriole. So we have to be careful. If they have any sort of heart disease, any sort of high blood pressure, eclampsia and preeclampsia, because those are conditions that cause what? Come on, nurses, what's the main reason why we can't give this?
Blood pressure.
Hypertension. What does preeclampsia and eclampsia affect?
Blood pressure.
The blood pressure. That's why you're giving the mag sulfate, right? Because when we increase the magnesium in the body, it lowers the blood pressure and protects them from seizures. All right, so you're always going to assess the blood pressure before you give this. Which one can't you give in asthma?
Methargin.
Which one?
Methargin.
For asthma, it's the hemabate, I believe, and the carboprost. Look it up if you don't know.
I think methargin you don't give for asthmatic patient.
You're saying the methargin.
Yeah, so that we should not give it to as
I don't think
asthma
it's the
patient.
methargin. I think it's the carboprost and the hemostat. If I'm wrong,
Yes,
prove
the
me
cap.
wrong.
No, that's it. The carboprost.
If I'm wrong, prove me wrong.
That's the carboprost and the prostaglandin E. It's contraindicated in asthmatic patients.
I don't think it's the methargin, because the methargin and the methylgonorvine are the same, aren't they? Let's see. Let's look it up, because I want to be right and I want you guys to understand.
Yes, it's the carboprost and prostaglandin E that is contraindicated.
Okay, the methargin is the same as the methylgonorvine, okay?
Okay, thank you, Ms. Losh. Thanks.
All right. So the main thing we're checking for that is high blood pressure. It's the same thing. All right, the nurse performs assessment of a pregnant woman who's receiving IV mag sulfate for management of preeclampsia and notes that the deep tender reflexes are absent. So what are we going to do based on this finding? What interpretation?
So it's increase mouth socket.
4.
4.
So
She's
yeah,
getting
that'd be
too
4.
much, right?
Yeah.
Yes.
All right. The nurse postpartum unit notes that a new mother was given methylgonabine, IM, because we give this IM, guys, following delivery. What assessment finding indicates the medication was effective? So why would we give it? What would we expect to see?
Normal blood pressure.
Decrease uterine bleeding. 3.
Okay, we're not looking at this to lower the blood pressure, okay? Why are we giving it?
For hemorrhage.
For hemorrhage.
So are we gonna decrease the uterine tractions?
No.
Okay, are we gonna decrease the bleeding?
Yes.
Yes.
All right. Sorry, people like to blow up my phone. I'm not even at work today and they want to blow up my phone. All right. A pregnant woman of 30 weeks gestation is admitted to maternity in preterm labor. The woman asked about the prescribed betamethasone. Doc, the nurse should tell the client about the medication which would promote which action?
Enhance
3.
fetal lungs. 3.
Okay, good. Chime in, guys. Please chime in. Just even if you don't know, take a stab at it so you can learn. All right. So we're trying to reduce the risk for respiratory distress syndrome here. That surfactant production won't start until around 32 weeks of gestation. So our job is to prevent respiratory distress in this baby. All right. And if we don't get this into mom or into the baby, it could cause the baby to die ultimately. A nursing student is assigned to care for a client with preeclampsia receiving IV mag sulfate. All right, we'll do this one. If we come across another one, we're going to skip it because I think you guys got the idea here. All right, the senior nursing student is assigned to care for a client with severe preeclampsia receiving IV magnesium sulfate. The co-assigned registered nurse asked the student to describe the actions and effects of this medication. Which statement, if made by this student, indicates a need for further teaching? So, would we expect this medication to produce flushing and sweating due to a decreased peripheral blood pressure?
Yes.
Would we expect this medication to decrease the central nervous system activity, acting as an anticonvulsant?
Yes.
Magnesium, yes.
For sure. That's the main reason why we're giving it, right?
Mm-hmm.
Would it increase acetylcholine and block neuromuscular transmission?
No.
Would it decrease the frequency and the duration of uterine contractions?
Yes.
Okay, so which statement is wrong?
2.
2.
Good job. If you go through the questions like that every time, you're going to get a lot more right. You got to get rid of what doesn't make sense, what isn't true. Methylgonabine is prescribed for a client with postpartum hemorrhage. Before administering the medication, the nurse should contact the primary healthcare provider who prescribed the medication if which condition is present.
Hypertension.
Is hypotension a contraindication here?
No, I said for
Four.
peripheral
Four.
vascular diseases.
Remember, it's hypertension.
Hypertension.
And that's why peripheral vascular disease, cardiac disease. Okay, so hypertension is the main one here, but also cardiac disease, peripheral vascular disease, preeclampsia or eclampsia, because in those conditions, we would expect an elevated blood pressure. Again, here we should know what's our priority assessment for that methogonarvine.
Blood pressure.
Three.
Okay, good. We're good with that one now?
Yeah.
Okay, a type 1 diabetic mother delivered a 4,400 gram newborn 3 hours ago. She already initiated breastfeeding. What should the nurse plan to do to maintain euglycemia in this client? Okay, first of all, what is euglycemia?
Normal blood sugar, right?
Normal blood sugar. Okay, good. Now, what do we know about these babies? And what do we know about mom?
We know that the baby can develop hypoglycemia, right? And the mom
And
too.
what's going to
'cause she
happen
was
with the
diabetic.
mom's insulin? What's going to happen with the mom's insulin requirements after birth?
It's gonna drop.
Okay, it's going to decrease likely. All right, so those things we have to give consideration to. Now, the baby already got the breastfeeding, right? Which is the first thing that we do for these babies, right? We breastfeed them early and frequently to prevent the hypoglycemia. If the baby's blood sugar dropped below 40, then we would start looking at possibly administering something else if the blood sugar is not responding. So we might have to give the baby a little bit of dextrose. All right, but that we don't know if that's happening here. All right, for mom, we know we have to decrease the insulin probably. So now let's look at the answers, because it looks like the answer choices are more correlated with mom, right?
Yeah.
All right, so keep MPO for additional 4 hours to allow the blood glucose to normalize. That's ridiculous, right?
No.
Yeah.
Okay. Administer 20 units of long-acting insulin as sufficient time has elapsed since delivery. I probably wouldn't give
No.
extra
No.
insulin here, right?
Right.
Mm.
Assess her blood glucose before administering any glucose-lowering medications. That sounds pretty good.
Yes.
Yes.
And administer her pre-pregnancy dose of metformin. Well,
No.
you know,
No.
that's a little bit of a
No.
distractor, right? Because we know that metformin is a drug that doesn't lower your blood sugar. So that's a little bit of a distractor there. All right. You probably should assess first. I mean, that would make the most sense, right?
Right.
The only other potential option would be one, but you can't just give somebody a pre-pregnancy dose, I don't think, without assessing. But that was a distractor because of that, okay? Because you should know as a nurse that metformin doesn't lower your blood sugar, and that's why they give it to the elderly. It doesn't have a hypoglycemic effect.
It's really ironic that Donald Trump will get on his social media site that
Can you
Truth
guys
Social.
mute, please, if you have noise in the background? Thank you. At 10 days postpartum, a breastfeeding mom develops mastitis. Okay, so what's mastitis?
Infection, right?
Okay, it's an infection. I know that, nurse. Be more specific, please.
Of the breast, infection of the breast.
Okay, and of the breast where? What's it affect?
The duct.
Okay. And what can they develop as a result of this? Plug ducts and abscesses, right?
Right.
So we have to prevent that. How would you treat mastitis? What are some of the ways we treat it?
Cold.
Cold
Therapy.
or warm, right? We'll put warm water and warm compresses to induce what?
Swelling,
The flow of milk.
inflammation.
The flow of milk, right? We don't want the milk backing up because it can block those ducts, right?
Mhm.
Right.
So that's also why we massage. What else do we do?
Antibiotic.
Okay, if they have that infection, what's the most common infection these people have?
The staph, orbit. Wait,
Yes.
Staph A
Staph aureus
from
from the
The baby's,
The
the,
baby's
it's the
mouth.
mouth, right?
the baby's mouth, and it's caused because a lot of times they get these dry, cracked nipples,
nipples. Yeah.
right?
Right.
Because
Mhm.
they're not latching right or they're not doing something right. So what are some other things that we would do to help this mom?
Initial breastfeeding.
And teach her how to hold the baby while they breastfeeding so the baby can latch properly.
Okay, good. All right, so now we're gonna help her with some interventions for this mastitis. So what are we gonna do here? Do we want her to take the full prescribed course of antibiotics?
Yes.
Yes.
Should she wear support for the breast?
Right.
Yep.
Yes.
Are we gonna initiate bottle feeding?
No.
No.
No, we will try to have the baby feed. Or if the baby's not feeding enough, we're gonna pump.
Mhm.
Analgesics, what would we prescribe here likely?
Anti-inflammatory stuff like that. Ibuprofen.
Say it again. Ibuprofen, NSAIDs, yes. And we can use heat or warm. I mean, heat or warm, that's the same thing, Suey. Hot or cold?
Yeah, I think
Go ahead. You want me to take off the ice pack?
no.
See, you could be the rationale. If you could be the rationale, you could answer any question, nurse. I'm going to make myself the rationale, even though I'm not an OB nurse, by the way. Most of this stuff I learned in the last couple of weeks because I'm trying to prepare it for you guys. I mean, some of it I taught before and I'm relearning it as I go along, but you know, I'm not an OB nurse. I haven't done OB nursing since I've become a nurse, and that was 25 years ago. But you could do this. It's about how you approach the question, how you train your brain. A postpartum client is diagnosed with the urinary tract infection, which measures should the nurse instruct the client to take regarding treatment and prevention of a future infection. So let's look at the answer choices, just knowing, okay? Wipe the perineal area from back to front. Is that how we do it?
No.
No.
Okay. Minimize fluid intake.
No.
No, we never minimize fluid intake unless what?
This is contraindicated, probably a cardio problem or something.
Right, cardiac or renal. So immobilization and fluids are something we never take away from the client unless it's detrimental to their health. Take the prescribed medication until you feel better.
No, they want to take the full
full
dose.
course.
Okay, urinate frequently throughout the day.
Yeah.
Yes.
Good. All right, so 3,000 mLs a day, 2 to 3 liters is what we usually tell them. Wipe from front to back. All right, they have to take the whole course of the antibiotics. Nurse visits at home, a client who delivered a healthy newborn 2 days ago. The client is complaining of breast discomfort. The nurse notes that the client is experiencing breast engorgement. So engorgement usually comes from what?
The baby not emptying the breast fully.
Okay, or someone who's not breastfeeding, right?
Yeah.
Okay, so which instructions would the nurse provide to the client regarding the relief of the engorgement? So remember, besides like ice packs and stuff for comfort, we can also use things like cabbage leaves and tea bags. And you might see that on some of your questions where they put the cabbage leaves in the freezer because it can mold around the breast and provide comfort as well. All right, massage the breast gently during the feeding from the outer areas to the nipples.
I mean, you want to massage them, right?
Okay. Bottle feed over breastfeed.
No.
Feed the infant at least 2 hours for 15 to 20 minutes each side.
Uh-uh.
Why not?
Well, you do
Yeah.
want to feed for 2 hours, but I think you want to do the breast that's engorged, right? First, to empty that one.
It's correct.
That's true.
Okay, so you want 3? Apply moist heat to both breasts
is
for
good.
about 20 minutes before you feed.
Yes.
Yeah.
Supportive bra between feedings. Yeah, those boobies are heavy. We always want them to wear a supportive bra. Now, if we weren't wanting them to breastfeed or they weren't wanting to breastfeed, then they would wear a binding bra. Okay, that's the difference. All right, so breast engorgement, supportive bras, feed frequently. We want to make sure they're emptying those breasts. So that's why they're switching the baby 15 to 20 minutes each side. And then they'll have an easier time latching if she softens the breast beforehand and expresses milk. Moist heat will help bring the milk down. That can be done with a shower or warm wet towels. And then massaging that breast, it will also help. Which instructions should the nurse provide care on a client following delivery on care of the episiotomy site to prevent infection? So what are we teaching her to prevent infection of this episiotomy? So 1, wipe the perineum from front to back after voiding and defecation.
Yes.
Use warm water to rinse the perineum.
Yes.
Yes.
Okay, and we want to make sure we're teaching them also to sheet that water front to back. Change the perineum pads 3 times a day.
No. Gotta do
Why? Why no?
it gotta be done as many times as possible.
Every time they use the bathroom, they should be putting on a new pad, right?
Yeah.
Take warm sitz baths
Yes.
3 times a day.
Yes.
Report a foul smelling discharge.
Yes.
Yeah.
Okay, good job. All right, so the perineal pad every time they eliminate. Good on that one?
Mhm.
When planning care for a postpartum client who plans to breastfeed, which important piece of information should the nurse include in the teaching plan to prevent the development of mastitis?
Let's see.
So what about 4?
You don't have to clean the
No,
breast, right?
You can clean it, but you can
Rinse them with water usually. I wouldn't put any sort of antibacterial soap on. That could cause drying of the nipples and cracking.
right. So I think 2 should be correct because 1 is
Okay,
out.
but we're going through them.
Yeah.
Express and discard milk from the affected breast at the first sign of mastitis. Why are we not doing that?
Because the milk is good for the baby, so
Okay,
you get rid
and
of it.
then 1. Why are we not doing 1?
But you gotta
'Cause
use
you want both breasts.
Okay, both sides to make sure that we're equally emptying them out. Okay, good. I'm not just looking for an answer here because I want to make sure you understand the material. So if you understand why 2 is the answer, you should also understand why 1, 3, and 4 are not the answers. That will make you answer more questions correctly. The nurse has determined that a postpartum client has uterine atony. Which actions should the nurse take in which priority order? So what's the first thing we're going to do?
a massage. And you're gonna contact the primary care provider.
I would say contact them last, right? We want to check them out drainage first.
Massage. Gotta give the information.
And monitor the vitals and then contact the primary health care provider.
Okay. Rationales. Julius, you wanted another way. What's your rationale?
So, when urine, is the one that causes the hemorrhage. So the first thing you gotta do is to massage, and in the process of massaging, you have to let the provider know, and from there, while the provider is being informed, plan to come, then you do the vital signs, and in that process, because the vital sign will tell you exactly the level, the amount of bleeding that has occurred. So after you do the vital signs, while provider is coming, then you check the amount, of that has been, expressed.
Okay. Do you think that the contact provider would want to know what the vital signs are and what the drainage are when you call them?
I would call the provider, but before I call the provider, I have to do the massage, and I'm speaking it based on what I read from the book.
Okay, let's see.
Yeah, that's wrong.
So massage first,
Then contact
contact the
provider,
provider second,
check vital
then
signs.
monitor the vital signs, and then check the drainage. Very good, Judas. And you explained it perfectly. So now, hopefully we all know, right?
Yeah.
Because I'm sure some of you were thinking what I just said. And then you heard what he said, and now you see the rationale. Sub involution, what is that?
So that is when the uterus does not reach or return to the pre-pregnancy stage.
Okay, so the nurse is caring for a client with a diagnosis of sub involution. Should recognize which conditions as a cause of this diagnosis.
So it can be caused by retain or fragment of the placenta, and it can also be caused by infection.
Who else wants to chime in here?
So I said 5 and 2.
Mhm.
It doesn't have nothing to do with the hormones, after pain. So 5 and 2 should be correct.
What about estrogen and progesterone?
No.
They can have for different things, but not that.
Okay, infections and retained placental fragments are primary causes of sub involution. Very good. Hormone levels don't cause it, and after pains would be an expected finding after delivery, right? Almost everybody has those. If you don't have them naturally, you'll have them as soon as that uterus starts contracting. So as soon as you breastfeed the baby or do something. All right, which statement by the client indicates an understanding of instructions? So we're giving instructions for a client with mastitis. All right, so we want to know which one, make sure they understand. So would they stop wearing a bra?
No.
They need a supportive bra. Antibiotics won't help because it's caused by a virus.
No.
What's the most common cause?
Bacteria.
Staph.
Staph
Staphylococcus.
from the baby's mouth. Okay, good. I need to stop breastfeeding until it's fixed.
No.
No, they need to continue breastfeeding.
Okay, good. The nurse is monitoring a postpartum client who is bleeding for signs of shock, which indicates an early sign of shock. So what are we going to see in mom? What's the normal findings? So would we see an increase in the respiratory rate from 18 to 22?
Yeah.
Yeah, I think so.
In the early sign. Is that an early sign?
No.
Or is
No,
that
no,
a
late
sign
sign.
No, that's a
that
late.
she's decompensating?
That's a late sign.
Because here we have our lungs are kicking in an attempt to put us back into homeostasis, right?
Right.
Okay, so think about when that would occur. Complaints of
And
feeling
late.
tired, yet is feeling hungry.
No.
Okay. Increased pulse rate of 80 to 120.
Yes.
So that's another sign of compensation, right? The body's recognizing that it's not perfusing. So it's increasing that heart rate in attempt to get more blood out to the organs. And then complaints of abdominal cramping.
That's two.
I was looking at three.
Two. I'm looking at two.
But I mean, that's increasing the pause. So the pause, when the bleeding has been, has occurred for a while, and the person is now, the blood pressure, completely dropped. So that's the time the heart will go up. So by that time, I think it should be, a kind of late sign, getting to confusion, agitation.
I'm still looking at two.
I
So
think
two should
I
be the
think
right
two.
answer here. 4 is a late sign, and the other two, if they do apply, they don't apply here.
Okay.
Okay, so after mom has that baby, blood pressure, pulse, and respiration are checked every 15 minutes, first hour. A rising pulse is an early sign of excessive blood loss because the heart is beating faster to compensate for the reduced blood volume, what we just talked about. All right, increase in the respiratory rate is not a concern, and it is within normal range. 18 to 20, that should say, not 120. All right. Again, if you were going to see a change in that respiratory rate, it wouldn't happen yet. It wouldn't happen until we're going into that decompensation stage of shock. The nurse is caring for a client who just delivered a newborn following pregnancy of placenta previa. When planning care, the nurse should prepare to monitor the client for which risk associated with placenta previa.
Hemorrhage.
Yeah, hemorrhage.
Everybody agree with that? What's DIC?
That's how to do a clotting.
And the body starts to clot.
What happens in DIC?
So go ahead.
No, you go ahead. Go ahead.
So the DIC, you know, I mean, is, I mean, they'll, I think it occur when when you know when bleeding is being initiated and to the point that blood may occur, something like that, and it can be severe.
So in DIC, the body is producing all these little micro emboli, and in response, it's sending out fibrogen, trying to counteract these little emboli. And so the body ends up using up all its clotting factors. And this causes mom, if she has any issue, to start to bleed out. And she'll bleed from any place in the body where there's a hole. So it could be the nose, it could be the vaginal area, the rectal area, any IV sites, any wounds, any place where there's skin integrity impaired or there's an orifice. Okay. Chronic hypertension. This would be something we would have expected over a long period of time. I wouldn't expect this to have anything to do really with placenta previa. Hemorrhage, definitely we would expect a risk factor for that, right? When does this placenta previa usually happen?
It happens in an abdomen pregnancy.
It happens when?
When it happens when pregnancy is I mean occur abnormally.
When does it happen?
Usually, I think it's during the second to third trimester.
Thank you.
Yeah, okay, you're right.
Puts mom at risk for shock. Okay, what is a hematoma?
Collection of blood.
Where is that likely to occur on mom?
After delivery.
Where?
Like
The
in a
perineal area.
perineum area.
Okay, what do you have to monitor for when she develops this? First of all, do we intervene?
Yeah, we do.
Yes.
How?
We should give her ice.
Apply ice.
What else would we do?
Probably check for hemoglobin because she can be bleeding through the skin.
What else?
Soup bath.
Vital signs.
Right.
Vital signs.
Yeah.
She can be hemodynamically unstable here. Okay, hemorrhage was the answer there. We're just talking about other stuff so you can learn it.
Okay.
If you learn it, then you understand why it's not the answer. Nurse provides a list of discharge instructions to a client who delivered a healthy newborn C-section. Which statement by the client indicates the need for further teaching?
I think number one.
Yeah, I'll go for one.
Okay, I didn't hear you go through the other answer choices.
Yeah, because I just started reading it. And
Okay, but you don't go through the answer choices, so you just throw an answer out there and you don't give other people a chance to go through them, and you're not telling me why it's one versus the other ones. And so therefore, you're not giving yourself an opportunity to really learn.
I believe it's number
And you're going to
3.
make wrong choices when you get to the exam because of that. So I'm trying to teach you how to study this and really understand it. So when you get on other questions that maybe aren't worded this way, you'll still be able to answer them. So do yourself that favor.
So it says
I believe it's number 3.
Okay, why number 3?
Because you have to give the uterus a chance to heal after the cesarean, and you can't start with exercising right away. You gotta just let it heal first.
Okay, is it just the uterus that you're worried about there, or that actual abdominal?
The abdominal area.
All right, what's the guidelines typically for someone who's post-surgical about when they can start to do things?
I think
4 to 6 weeks.
Okay, so you have to take that into consideration. Okay, we wouldn't want them to contact the doctor if they're feeling depressed, because if it goes longer than how many days, it could be something other than the baby blues. How
Three
many
to-
days?
3 to 5 days.
3 to 5 days?
No, after 10 days,
Thank you.
Oh, okay. I'm
After
sorry.
10 days, we start looking at a potentially more severe depression.
Depression,
This
right?
is why it's important for you to go through the answer choices.
Okay, so I can defend the reason why I said 1, because fever in time of C-section is something that we got to look at. It's a sign of infection.
When? The first day? The first 24 hours?
No,
3
not
days?
it's
no,
normal.
not
2
let's
weeks?
say.
When?
So, okay, fine. So this occur after the first 24 hours when
Because what's
when the
happening in that
temperature
first
is
24 hours that might affect mom's body temperature?
diaries, the mother, she losing fluid and stuff.
Right, there's a lot of fluid changes going on there, right?
yes.
Yeah.
Okay, what about 2? Is 2 true? Even though she's breastfeeding, she can still ovulate?
Yes.
Yes.
Yes, she does.
Yes.
Okay, so some of you like 1, some of you like 3. I don't think that a fever is something we should not worry about, especially for a C-section, because they have an impairment in the skin, and I feel like they would be higher risk. 3, I mean, if we're talking about 4 to 6 weeks, she might be okay. Let's see who's right.
So it's fever.
Again, this is why you want to just go through the answer choices and say, okay, if I were teaching the client right now, what would I teach them? Because if you could remember that you would teach them that the abdominal exercises can begin in 4 to 6 weeks, that would help you to eliminate that choice and make a better answer choice. That's why I'm so adamant on this process. Okay. And as you talk through it, you're teaching yourself, you're learning it. And here's the thing, if you're not reading through every answer choice and breaking it down, then you may skip over stuff that was important. And one might not be the best answer choice here. So make sure you read thoroughly through it.
Okay.
Nurses just received an inter-shift report after reviewing the client assignment and the appropriate medical records. The nurse determines that which client is most at risk for developing post-delivery endometritis.
I believe it's number 2.
Number 2, you said?
Yes.
And anybody else?
I'm looking at number 4.
Okay, why number 4?
Because it's a C-section, and besides that, it wasn't planned. It's emergency. So sometimes during emergency in those situations, a lot of things sometimes go wrong.
And it's
Some-
more common with
With
C-sections,
C-section,
right?
and then it's now a planned C-section. So it's like 2 things in there.
Okay, so what is endometritis itself?
The
It's
infection in the
infection
uterus.
of the lining of the
Okay.
uterus.
It's an infection in that uterine lining, in that mucosa area of the uterus, and risk factors for it are prolonged rupture of membranes, multiple vaginal exams, excessive length of labor. Those are some of the risk factors for it. But cesarean delivery is the primary risk factor for this infection to develop. So that's why it's 4 here. All right, so it's this acute infection of the uterine mucous lining. Mucous lining after a C-section is the primary risk factor for the uterine infection, especially if it's an emergency C-section. All right, additional factors would be the prolonged rupture of membranes, the multiple vaginal exams, excessive length of labor or prolonged labor. Feel free to take a picture of that if you don't know, because it felt like a lot of people didn't know this. The rubella vaccine has just been prescribed for a new mom. Which statements should the postpartum nurse make when providing information about the vaccine to the client? So what kind of teaching are you going to do with mom about this? So let's start with 5. Should she avoid heat and extreme temperature changes for a week after receiving the vaccine? And if you never heard anything
No.
about that, then, usually if something's true about something, we'll hear a lot about it.
So no.
You should not become pregnant for 1 to 3 months after receiving the vaccine.
Yes.
Yeah,
True.
Okay, good. That's true because it can cause damage to the baby, right?
Yes.
You should avoid sexual intercourse for 2 weeks after administration of the vaccine.
True.
For 2 weeks?
No.
No.
I mean, if
No,
it's
no.
1 to 3 months, if I'm going to tell her to avoid it, then I'm just going to say, hey, for the next 3 months, don't have any sex. You need this vaccine because you are not immune to the rubella virus.
Yes.
You will need a second vaccination at your 6-week postpartum visit.
It's because their difference is not that obvious.
true.
Test for example, 5-point difference, like
So 1 would only be based on what their titers are. If they didn't develop a high enough titer, then they might need a second vaccination.
So 2 and 4.
Again, that may be, discussed by the physician. Because sometimes people just won't, no matter how many vaccines you give them. They won't develop the immunity. We're going to go with skipping this. The nurse is checking lochia discharge in a woman in the immediate postpartum period and notes the lochia is bright red and contains some small clots. Based on the data, the nurse should make which interpretation?
I think it's 3.
3, yes.
Okay, so if it is 3, then we wouldn't do 4 because we wouldn't talk to the doc about that. Usually the clots are what size when the client's hemorrhaging?
Large.
Large, but large meaning what? 5 centimeters, 1 centimeter, 10 centimeters? What's large mean?
Well, it's more than 1 centimeter.
Okay, usually more than 1 centimeter. Good. Okay, it doesn't say in here, but usually I'm pretty sure your book says more than 1 centimeter. Okay, woman is gravid at 3, parent 3, had a C-section 1 day ago, being treated prophylactically for endometritis. She's complaining of abdominal cramping at 6 on a pain level of 1 to 10 and fears having her first bowel movement. These medications are prescribed and due to be administered now. In which order should the nurse administer the medications?
I would say 4 first. The 4, I said 4. Then 3.
And 2.
The 1.
Okay, so pain medication, that's what the Ketorolac is, right? That's the NSAID. Then the antibiotic. Then the Colace, then the prenatal vitamin. Everybody good with that one? I have the harder questions on the sheet that I'm going to send you guys. This way we can keep going through these ones. And at the bottom of the sheet will be the answer key with the rationale. So a lot of the questions on there will probably help you out with the exam. I looked at some of them. I didn't look at all of them.
Thank you.
And you guys have the notes for those other chapters. I really didn't want to just do a lecture today because I want you to try to go through the questions and try to understand. I think that will help you a little bit more, and also sort of help you understand where your weak areas are. Where do you need to really go back in and hit the books at? These questions that I have up here today, you go under your Saunders book. Everybody has that registered, right?
Yes.
So when you go under there, don't go under content, go under health problem. And then go to maternity, and besides the box, you'll see a little arrow. You click on that, and then you can click the different health problems that are associated with the newborn, with pregnancy and all that, so that rather than just getting those basic questions, you can go to content too and do basic questions, but this will bring you to like specific issues and problems. On assessment of a client who's 30 minutes into the 4th stage of labor, the nurse finds the client's perineal pad saturated with blood and blood soaked in the bed linen under the client's buttocks. Which is the nurse's initial action? So what should you do first?
Is it 3?
Okay, why 3?
Because it seemed like she bleed hemorrhaging, so you want to massage the fundus?
Okay.
Or either 2.
Okay, what would 2 tell you?
If she is hemorrhaging.
So when I was in, nursing school, as soon as we saw blood, we were always taught 3 is the first thing that you do. Because once you go to 3, if 3 is not boggy, then that is going to guide you in another direction, right?
Yeah.
And we also know that what is the most common cause of postpartum hemorrhage?
Uterine.
So when we're doing 3, we're actually assessing for that, right?
Yes.
Okay, good. The discharge nurse, we're going to skip mastitis. I think you guys are good with that. The nurse has provided instructions for a postpartum client at risk for thrombosis regarding measures to prevent its occurrence. which statement, if made by the client, indicates a need for further instruction. So number 4, I should avoid pillows under my knees, true or false?
True.
Okay, so we can toss that one, right? Because we're looking for a wrong statement. I should perform regularly scheduled exercise such as walking, true or false?
True.
True.
Okay. I should avoid prolonged standing, sitting in one position.
True.
True.
This is why we really don't want them to fly on airplanes or take long car rides unless they can get up and move about. Embolism stockings, when do we put those on?
Before you get out of bed.
Okay, good. And again, you know, your answer choices can guide you here just by using them to your advantage. I always start for the bottom and go up, because people that start from the top and go down sometimes will get to an answer they like and they stop reading. And that's a mistake, especially with nursing questions. Which client would be most at risk for development of a postpartum thromboembolic disorder? So when I read these questions, most at risk, I'm going to try to find something that has more than one risk factor. Okay, so if we're talking about a DVT, I'm looking for somebody that's obese, somebody that smokes, somebody that doesn't move a lot. These are the kind of things that I know would put them at risk, or if they had some sort of clotting disorder. All right, so, or, you know, like AFib, some sort of cardiac issue like that. The nurse is employed in a prenatal clinic and is performing prenatal assessments on a client in the first trimester of pregnancy. The nurse is concerned with identifying clients who may be at risk for development of postpartum complications. Which client would be most at risk for development of a postpartum thromboembolic disorder? So I'd also be looking at people on any sort of estrogen, because estrogen increases the hypercoagulative of the blood. I'd also be looking at anybody on birth control, because a lot of the birth control things have estrogen and stuff in them. And then age is also another factor. All right, 22-year-old woman in first pregnancy who states that oral contraceptives taken in the past have not caused any adverse effects. So we could probably eliminate that one, right? Yes or no?
I mean, but she on oral
Yes.
contraceptives though, right?
She states that oral contraceptives taken in the past. She didn't say she's
okay,
on.
okay. So she's not on it, yeah.
And they didn't cause her any problems in the past.
Mm-hmm.
I mean, you can keep it there as a maybe if that makes you feel better. A
No, it's
30-year-old
fine.
woman in her fourth pregnancy is of normal weight. So you see anything there that would put her at risk?
No.
Would multiple gestations put her at risk? So that's what you would have to look at, because she's fourth pregnancy, right? So that's what your risk factor that they're throwing in there is.
Oh, yeah.
Okay, if it is one. All right. 24-year-old with a thin frame who's a vegetarian.
No.
And then a 39-year-old woman who reports that she smokes.
Yes.
Yes.
Okay, so you feel like one because what?
Her age and that she smokes.
It's 2 factors.
Okay. So factors are smoking, varicose veins, obesity, a history of thrombophlebitis, women over 35, those who have had more than 3 pregnancies. So that multi-gestation does matter, but she didn't have as many risk factors as the other woman. All right. And those that have had a cesarean birth. A postpartum client develops a UTI. The nurse instructs the new mom on measures taken for treatment of the infection. Which statements if made by the mom would indicate need for further instruction? Select all that apply. So 5, I may need to bring another urine sample to the lab after treatment is complete. Is that true or false?
True.
Yeah, because we have to make sure that the antibiotics work. And sometimes when people have chronic UTIs, which a lot of these people do. All right, we would want to make sure that the antibiotics work. So we can get rid of that because we're looking for a wrong answer. I need to try and hold my urine as long as I can and urinate 3 to 4 times a day.
False.
False, right? We want them to urinate frequently and often. Foods and fluids that acidify the urine are best to consume.
False.
So acidic foods, do they help fight bacteria? Like cranberry juice and stuff like that?
Oh, yeah.
Yes.
So that's probably a true statement. I probably wouldn't throw it out. The prescribed medication needs to be taken until I feel better.
False.
Okay, why?
It needs to be
You need to take the
completed.
full dose.
Okay. And I need to drink a lot of fluids, especially water every day.
True.
True.
Okay, so water, and now they give cranberry juice. Here's the thing you have to worry about with cranberry juice, okay? You have to be careful if the person is doing that and medication. A lot of people think because it's cranberry pills or it's cranberry juice that there's no side effects to it. That's not true. Okay, so we do have to be cautious with it, and you want to be careful if they're doing both. Okay, so 2 and 4, good. Acid, always think about acid in the body. It's going to help break down the bacteria. But we can't have too much. Too much is not compatible with life. The rubella vaccine is prescribed to be administered to a client 2 days after delivery of the child. The nurse preparing to administer the vaccine develops a list of potential risks associated with the vaccine. The nurse reviews the list with the client and cautions the client to avoid which situation.
Three.
Okay, why not 4?
Because they could.
Say it again.
You want to avoid the pregnancy, not sex.
Okay, and if we go home and tell their husband that, what's going to happen? He's going to come back and shoot the gynecologist. Okay, so we would teach them how to use additional methods of birth control, right? That would be more important because that would be more realistic than them avoiding intercourse. Postpartum unit nurse is assessing a client who's at risk for thrombophlebitis. So what are those risk factors?
Smoking, obesity,
age, multiple pregnancies.
sitting for long periods of time.
And cesarean birth. Okay, good. So we're going to assess. How would we do it?
I say 1, you're palpating for the pedal pulses. That'll give you an idea. If it
Everybody agree with that?
before,
Okay, I think your answer here is going to be 2. We used to do something called home ensign. We don't always do that anymore, especially if we suspect the DVT, because sometimes home ensigns can cause the DVT to break loose and travel, and now it's a PE. They're asking more about thrombophlebitis, which would be inflammation of the vein, but still it's going to lead to the same consequences eventually if we don't treat it. Again, moving could cause more pain, or if the DVT did develop, it could cause it to dislodge. So typically we have them on rest for this. Elevated leg. And sometimes we'll put like cool packs or whatever on it. Or warmth. Postpartum care unit nurse is reviewing the records of 5 new moms admitted to the unit. The nurse determines that which mom is most likely at risk for developing a puerperal infection.
So 4. Two. And 1.
Okay, why isn't it number 5?
Well, she expected, it was the expected outcome with delivery of the placenta, it says.
Okay, why number 3 isn't?
I mean, the baby was small. And it was, I don't know, birth
Is it
vaginally.
small? Is it normal?
Not, it's
What
a
is
normal
it?
size baby.
Okay. We would expect this probably more with what? A macrocytic baby? Of course, a previous history would definitely be an indicator. Why 1?
Because it's multiple vaginal exams.
Okay, good. So again, risk factors, history of previous infection, C-section, trauma, prolonged rupture, prolonged labor, multiple vaginal exams, retained placental infection, in fragments. Let me get the talk together. I didn't even start the tequila yet today. All right, a client with known cardiac disease has been admitted to the postpartum care unit after an uneventful delivery. The nurse instructs the client to use the call bell for assistance whenever she needs to get out of bed or wishes to care for the infant. Which postpartum complication is the nurse most concerned about for this client? So she has what here? Known cardiac disease going into delivery. So what would we have to worry about with the mom that has cardiac disease going into the delivery?
Overexertion?
Yeah, because it may be too much for her. She may get exhausted easily. All right. We are worried about her bonding with the baby, but that has no effect with what?
Cardiac disease.
And the same with number 2, because there's really not much difference between 2 and 4, right? So you could eliminate those choices right there. And yes, we're worried about infection, but you know, our big deal here is how much did she have to exert herself? Good. The nurse is assessing the fundus of a postpartum woman and notes that the uterus is soft and spongy and not firmly contracted. The nurse should prepare to implement which interventions? So we have a uterus that is boggy. So what are we gonna massage? Some of the first things we're gonna do.
Massage it.
Up, stop it, nurse.
Oh,
Go to the bottom.
Okay.
Why are we not doing 6?
Because they don't need a hysterectomy.
Okay. What about 5? Are we going to do that?
Yes.
We would want to do that before we massage it, really, if that's a choice. Why? Because that might be the reason why, and we need to fix that first. And then, because if we're massaging and that doesn't work, then likely this is the culprit. All right, rechecking the uterus in 1 hour. Okay, we'll just leave mom and come back.
No.
Assisting the woman to urinate.
Yes.
Pushing gently on the uterus.
No. I don't know. And 1, yes.
All right, does anybody think 2 should be an answer? And if so, why or why not?
I think no. But then it says gently. I don't think so. But I don't know.
Stop it, nurse. You know, your heart is telling you no. So why are you still contemplating it?
Mm,
Don't do that on the test, okay?
all
No
right.
means no. No means no, nurse. All right, you don't want to push on it because you could, you know, push it out of place or cause some kind of pain or something. Oh, also, if it's uncontracted, it can invert it, which is sort of what I was leading to, but massive hemorrhage and shock as well. The nurse suspects the presence of uterine atony and massages the uterus, but this action does not assist in controlling blood loss. What would be the next action?
Three.
Notify the doc. Okay, why? Why aren't you calling the blood bank first?
So we don't know if they need blood.
Okay, well, you probably are going to do that, just not right now, because what's your rationale for 3?
Well, I only said 3 because of the last question, but I would have did some, I guess I would have measured and did the blood pressure, but I know that was wrong because of the last question.
Okay, so you're doing 3. Why though? Come on.
So you can let them know that the patient may be hemorrhaging.
Why? Why do they need to know?
They might order oxytocin.
Thank you.
Oh, okay.
You might need a uterotonic because the massage didn't work. And in this case, there's no indication that there's some other cause here. They're saying uterine atony. So for uterine atony, if the massage didn't work, what would be our next course of action? And that's what's guiding your answer choice here. Our next course of action is going to give that oxytocin, that first line, unless the client's contraindicated. All right. Then we would go on to something else. If we were going to give her menthrogonarvine, then we'd have to make sure she didn't have what?
Hypertension.
Or cardiac disease or peripheral vascular disease. What if we were going to give her carboprost or hemabate?
Asthma.
Okay. Just keep challenging yourself. What would I do if this happened? What would be my measures? How would I do this? Without even answering the question. That's going to bring more brain knowledge. Trust me. Nurse is caring for a client in postpartum period immediately after delivery. The nurse performs an assessment on the client and prepares to assess uterine involution by taking which action? So we're looking at involution. What would we do? 2, we need to know what the fundal height is, right? 4 isn't going to tell us that. 4 would tell us about hemorrhage, right? Or if we were looking at the smell and the contact, it could tell us about hemorrhage or infection, which we really wouldn't expect to see right away anyway in the postpartum period, but it could happen, especially if she had an infection going into the pregnancy. Auscultating the bowel sounds isn't going to help us here, and monitoring the vital signs would tell us if something changed in her, if she was going into shock, but it's not going to tell us the position of the fundus. So vital signs we're looking at when mom has like a hematoma, something like that. We're looking at vital signs if we think it's infection. We're looking at vital signs if we think it's shock. Which nursing intervention is appropriate for a postpartum client with the diagnosis of endometritis to facilitate participation in newborn care? So I mean, one, we know that this is a very painful situation here. So let's look at number 4. That's a good potential choice. Number 3, we're not going to do. Okay. We wouldn't want other people taking care of the baby unless that's what mom wanted, because that's going to interrupt the attachment and the bonding process. We're not keeping her supine. All right. Because that could put her at risk for other things. And we don't limit the fluid, right?
Yeah.
So that brings us back to the only really plausible answer here. Again, if you don't know what the answer is, use your other answers to guide you to the choice. Nurse is monitoring a postpartum client who's at risk for developing postpartum endometritis. Which finding, if noted in the first 24 hours after delivery, supports the diagnosis of postpartum endometritis? So finger fundus, 2-finger breast below the umbilicus, midline, and firm. So 24 hours post-op, where is that fundus supposed to be going? Is it at the proper place here? Does it look like it's where it should be?
Yes, right.
Okay. About an oral temperature of 100.2. When do I worry about mom's temperature?
After 24 hours.
And at what level?
Above 104.
100.4 usually or higher, right?
Mm-hmm.
Increased diuresis and appetite. Would I expect to see this in mom?
Yes.
Okay, she's going to be pushing those extra fluids she got out, and hopefully she's over that little bit of tiredness now and she can eat. So that would guide me to think that this answer choice was 1, even if I didn't know. Right or wrong, nurse?
Correct.
Right.
It worked, huh? Because how many of you were looking at 3?
Mm-hmm.
You don't have to say so, but I know where sometimes our brain goes. And actually, this says 104 and higher, which is what Diana was saying, but I thought it was 100.4 or higher. The postpartum nurse is caring for a woman who just delivered a healthy newborn. The nurse should be most concerned about the presence of sub involution if which occurs. I don't think we did this one. I think we did another. Did we do this one?
I think because it was the same placenta, right?
Similar
Placenta
question.
fragments, right? That was the one we were
Yeah.
worried about. Okay. The nursing student is assigned to care for a client in the postpartum unit. The co-assigned registered nurse asked the student to identify the most objective method to assess the amount of lochia flow in the student. Which statement, in the client, which statement, if made by the student, indicates an understanding of the method? So how are we assessing for that lochia flow? So I can look at the perineal pad and gauge the amount of staining and relate it to the amount of time between pad changes. What do you think about that?
No.
I should weigh the pad before and after each use and note the amount of time between each change.
Yes.
Okay, that sounds pretty good. I should ask the client to keep a record and document every time the pad is changed. So the client can do their own assessment, right?
No.
I can estimate the amount of blood loss by gauging the amount of staining on a perineal pad.
No.
So weight is really your highest indicator, right? Because we know that a pint of fluid is equal to almost 1 pound. All right, so that's how we would do it. We would tear what the pad weighs, then weigh it, with the fluid in it and subtract whatever the weight of the pad is. Same thing with diapers. Client has just had surgery to deliver a non-viable fetus resulting from abruptio placentae. As a result of the abruptio placentae, the client develops disseminated intravascular coagulation and is told about the complication. Client begins to cry and screams, "God, just let me die now." Which client problem should be the priority for the client at this time?
One, lack of power.
Okay, I'm not sure if that's the right answer here, but I like it. Um,
I'm looking at 4.
okay, why 4 over 1?
Because she doesn't have control of her health, so her health is a problem, and then the loss of the baby. So yeah, it's kind of like two things going on here. Two situations.
Okay, because 4 addresses more about her loss of the baby and her own health. Because with the DIC, she could potentially die here. All right, as well. And how would we treat that DIC? What's one of the ways that we treat that?
Hysterectomy.
A what?
Hysterectomy.
A hysterectomy? Is that what you were saying?
Yes.
No, for DIC, remember, this is a bleeding disorder. So the client's basically bleeding out here. So in order to correct that or reverse that, we would actually give heparin.
Heparin, yeah, that's what I think.
Why heparin? Heparin would make me bleed more, wouldn't it?
It would
Heparin can
break the
reset the
clot.
clotting cascade. So it's got a weird effect here. It can reset the clotting cascade and make them start to go back into normal function, because that's what's happening here. The clotting cascade is interrupted. So they don't have the ability to clot, and that's why they're bleeding. Okay, so 4 was a better choice because it addressed both. The home health nurse visits a client who has delivered a healthy newborn infant via vaginal delivery. An episiotomy was performed, and the woman has developed a wound infection at the episiotomy site. The nurse provides instructions to the client regarding care related to the infection, which statement made by the mother indicates a need for further instruction. So I need to isolate the infant for 48 hours after beginning the antibiotics.
That's false.
Okay, I need to apply warm compresses for comfort.
That would be true.
Sitz baths to promote healing.
True.
And antibiotics as prescribed.
True.
So nothing else really makes sense there. Judge Judy says if it don't make sense, don't pick it. It's not true. A mother received an epidural anesthesia during labor and had forceps delivery after pushing for 2 hours. At 6 hours postpartum, her systolic blood pressure dropped 20 points, diastolic dropped 10 points, and pulse is 120 per minute. Client is anxious and restless. On further assessment, a valvular hematoma is verified. Now, you see what I'm talking about here?
Oh yeah, because she could be bleeding based on the hematoma.
Yeah, that hematoma can change those vital signs. So you got to make sure you're monitoring. Further, after notifying the healthcare provider, so we notified the doc, what are we going to do next?
Will we?
So first of all, you have to think about where it is. That's going to guide treatment. This is the most common type of hematoma, by the way.
So I would do 4.
I would say 3.
Okay, so we've eliminated 1 and 2 then, correct? Because your client is definitely bleeding here.
Yeah.
I'll go for 4 also.
Okay, 4 is the correct answer here. All right, the hematoma is going to be that collection of blood. The vulvular type is the most common. It's caused by epidurals, prolonged second stage of labor, forceps being used, and the lady will collect blood up in that area up to 500 mLs. All right, so we might use the other options, but the priority action is to stop that bleeding. And the only way you could do that is through surgery. All right, last question here, guys, and then I'm going to send out and make sure everybody got the little list that I sent you before I sign off. All right, the nurse is creating a plan of care for a postpartum client diagnosed with superficial venous thrombus. The nurse anticipates what intervention would be prescribed. So she's got a superficial DVT here, or venous thrombus.
So definitely we won't do 2 because it's superficial. So I'm looking at, I've let 3 or 1. I think 3.
Okay, anybody else want to chime in here?
2.
Okay, so like Diana said, 2 is probably not going to be our first choice here unless the condition persists. Why 3? What would 3 do? So 3 helps promote blood return back to the heart, okay? So using that gravity to help us by elevating, that's what we're going to do here. All right, let me make sure that, let me stop my share here. Stop my recording.